There was a small pilot study done at Insight, and they found that when people tested their drugs and found that there was fentanyl present, they were much more likely to reduce their dose. The fentanyl test strips are more widely implemented, and they've been used in Ontario as well as in British Columbia. At Insight, they're also using an FTIR spectrometer, which is a more advanced form of testing, and they're piloting that right now. And so we're watching closely to see how that's working for them. But the test strips are, I think, potentially a very important tool for helping people understand better what they're using. They're really seen as a tool for harm reduction, and so they're about having a conversation with people about what is in their drugs and what the limits of the technology are. And so anytime you can give people a bit more understanding than absolutely none about what's in their drugs, I think it's a positive. Obviously, the key will be to ensure that education and programming is rolled out in a way that makes sure everyone is very cognizant of the risk of a false negative. The reality is that these drugs are produced in clandestine settings, and they're completely uncontrolled, and so we have very little ability to control what's in them, and so the best strategy is to implement programs and services that are effective for substance use in general and opioids specifically.
So there are a number of different agencies across Alberta that are looking at how best within their individual setting and community they can really make people aware of what the opioid crisis is and make sure we're working to reduce stigma of people that use drugs. So one of the really important things is messaging that substance use is a health issue and that people should be treated with compassion and care, and realizing that opioid use can affect anybody in the population.